So thank you for those who are introducing themselves in the chat. And welcome to today's webinar. It's hosted by DBHR, and that's through the Washington State Healthcare Authority. It's interactive, so we're encouraging you to ask questions, participate throughout, whether that's using the chat function, or we are able to unmute our mics, and you can raise your hand if you have a question, or certainly use the chat. We'll send out the slides and recording after today, so everything will be sent to you. Any materials that we do use, we will send those out. So let's get started. It's about 1 after, so I think it's, well, people may start to join, but we will get started now. My name is Joni Dolce. I am an assistant professor at Rutgers University here in New Jersey. So on the other side of the country from where you all are. I have been providing employment. I provided employment services, supervising supported employment programs for a number of years. I currently provide trainings and webinars on the topic of supported employment and career services. One of my passions and interests is getting a better understanding of employers' views regarding hiring individuals with mental health conditions. And also my dissertation, I'm in the tail end of my dissertation collecting data, is around managing personal information in employment and getting a better sense of what employers' views are on that topic. So the job developers community of practice is really something I have been doing for probably 5 years now with Washington, and it's really enjoyable. If you're new to the call, we spend some time talking about successes and challenges. It helps us kind of provide some feedback to one another. You can get some really good suggestions and support from your peers on the call, as well as myself. And when Darren and Dawn are available, they are able to jump on as well and provide some good feedback. It also helps us prepare for future calls. I see many people are introducing themselves in the chat, so please go on and read those. See where your colleagues are from. You might make some good connections and network with one another. But we're going to get started. We're specifically going to review motivational interviewing in supported employment. And it's such a broad, very, very large, lots of content related to motivational interviewing. We're going to focus today on listening for change talk. I have a couple of activities that we're going to do to listen to change talk. I have some resources I'll provide. So we're going to spend just a small hour today focusing on this one area of motivational interviewing. I will let you know that in addition to my role, if we could make sure our mics are muted, that would be great. I think it might just be me on the call today, so it's kind of hard to thank you. I am also part of SAMHSA's Mental Health Technology Transfer Center for the Northeast and Caribbean, and we have a wealth of resources and tools. In fact, myself, along with some other colleagues, created a 6-hour Train the Trainer curriculum on motivational interviewing, and that's cited here at the end that you can download. It has all of the notes, tons of information, again, some additional resources, since we're only focusing on a bit today. But before we get started, I did want us to spend a little bit of time reflecting on the past couple of months, reflecting on how things are going, maybe looking at some successes, some challenges that you may be encountering. You could use the chat or unmute your mics. So let's hear, what's happening. How are people feeling in terms of overall success or overall challenges in your role as an employment specialist, when you're job developing, any other areas that you want to speak around? So if you want to raise your hand, use that feature. It's under reactions. If you want to, I think you can raise your hand in meeting or just unmute your mic or type in the chat. So I'm going to look at the chat right now to see if there's anything. Oh, thank you, everyone. So many people are putting in the chat who they are, and I'm seeing a lot of other people following up on, maybe making some plans to network and so on. So Heather wrote in the chat about my reflection here. She's not been working yet with an employment client, but I am excited to learn how to utilize these skills moving forward. It's certainly fair enough. You may not be working with someone right now, but let's use this opportunity and consider what are some of those challenges, or maybe someone wants to share a success or two. And it doesn't have to be related to motivational interviewing. It could be something that you're, hi, Jamie, welcome. Also excited to learn new skills. It looked like someone had their hand up and I might have missed it. So if you want to raise
Hi.
Yes.
My name is Sharmila Libra. I'm with Pioneer Human Services as a substance use disorder counselor. And I would say, at least in our aspect or our avenue of we work with inmates,
Okay.
Kings County Correctional Center in our program. So I would say one of the challenges is with kind of the transition they may have, if they're either going to continue in the prison system or when they go back into the community, is finding resources for them to kind of slowly integrate back into the community can be a challenge, because some don't have family. They're here in the state of Washington alone. They may not have any kind of support system. So
Okay.
that could be a challenge that we can face when they're in that transitional period.
Yes, I thank you for bringing that up. And I think that's something that we have been talking about, having a longer webinar or a longer monthly community of practice call around that, working with individuals who have justice involvement, how to help with the transition, how to help identify resources in the community. We can certainly add that to our list of future calls. I think that's a topic that many people can benefit from. And maybe we won't have time right in this moment to speak about that challenge, but we can certainly add that possibly for August's call. Thank you for bringing that up. Okay, I'm going to just, all right, looks like some people are networking in the chat, which is great. So please continue to do that. And we are going to move on to thank you, Sharmila, for sharing that information. And maybe others have similar challenges that you might be encountering, just in terms of people who might have unique or, additional barriers in addition to a mental health condition, but also some additional barriers like justice involvement or lack of resources in the community, lack of knowledge or supports of where to access those available resources. So thank you. So let's move into our discussion today. I just want to peek, there's one more chat. Okay, yes, please continue to network in the chat. So we're going to just define very, very briefly motivational interviewing and talk about its use in employment services. We're going to spend a little bit of time differentiating between sustained talk and change talk. We're also going to look at some skills to elicit change talk and minimize sustained talk. When we were asking questions from previous calls here, a lot of what people were identifying as challenges centered around individuals' readiness and individuals moving towards change. And sometimes the providers felt frustrated or maybe ill-equipped in the moment to listen for change talk and help to minimize sustained talk. So we're going to spend a little bit of time doing that today. Efren in the chat mentions, as a counselor case manager, I work closely with our SC services. It's very encouraging to help clients with behavioral challenges to be able to find employment opportunities. Yes, thank you for that information. So before we get started, I do have a quick poll. I'm going to pull it up here. Let's see. Where is it at? All right, hold on. So it's a very, very quick poll. So can everyone see it? You can vote yes or no, but who uses motivational interviewing in their work? Just to kind of get a sense of who's currently using some elements of motivational interviewing. We'll briefly define it. Just helps me get a sense of the group and some of your experiences. Okay, so far it looks maybe about 75-30-ish. Looks like the majority of people are using some aspects of motivational interviewing. So we're going to end the poll now, and here are the results. So, about almost 80% to 20%, a fair bit of you are using motivational interviewing. I'd love to hear a little bit of how you're using it and what types of what parts of MI are you currently using, and what that looks like in your organization. You can use the chat. Looks like we have a couple of chats. Okay, so Amber, I work with a lot of unhoused individuals, so many of them want to work, want to be self-sufficient, have done some amazing work in the past. How just to reflect on this for a minute, it was from our previous question, but Amber, how optimistic and hopeful that statement is that, and we're not going to talk about MI specific skills, but that part that you just wrote in there, people want to be self-sufficient and they have done really amazing work in the past, is very much aligned with MI. You're seeing something positive and strengths, and you're acknowledging that, you're affirming that. So thank you for sharing. Jeffrey, I try to make sure to ask open-ended questions when enrolling persons in employment services. Absolutely. So using some of the ORS techniques, open-ended questions, Jeffrey's eliciting information. Glenn is a case manager and uses MI to help patient process change in their health and well-being. So specific to health and well-being, MI is certainly used in a variety of settings. Making positive statements, what I am hearing them say. Yes, so kind of reframing and a lot of those reflections and using affirmations. Renee, our program is client-centered, asking open-ended questions and remembering the client is the expert in their life. That is key. And again, not going to get into the spirit of MI, but really embodying that spirit of collaboration and partnering with the person, realizing that the person is the expert and resisting that writing reflex, right? That urge to give advice or tell the person what they should be changing and how to change. We are career coaches and they're to support and guide in their employment and education journey. Yes. Bill Miller from the MI world kind of uses the analogy of a tour guide when he talks about motivational interviewing. We're not there to just follow along and not be very active. That would just be person-centered or client-centered therapy. We're not there to provide advice and kind of, control the situation. We're there right in the middle to guide the person. So I'm glad that you mentioned that. Lots of open-ended question, various MI techniques, sharing how great getting a paycheck feels. So certainly all of these are great. So many things in the chat. I would use it to determine the kind of things they're passionate about so they can tailor possible work options. Amber, I use a lot of evoking when people tell me about their work and what they've done in the past. They mention a kind of work they excel at. I try to bring out the past into the present and remind them that they are still that person. Absolutely. So we're going to look at MI through the lens of much of what you all have mentioned, client-centered, partnering, the client is the expert, being hopeful and optimistic, having some compassion and so on. Let's just see one more in the chat. Catherine, share, we are here to help with accommodations and carving positions that fit them best, such as time of the day, benefits planning, meeting their needs and wants. Absolutely. So we're gonna move right into just a brief overview, just some background on motivational interviewing from the sense I get that many of you are practicing MI in your current positions. You probably have some familiarity with it. And I say this more as a reminder that MI is evidence-based. Over 200 clinical trials, 1,200 published articles. MI has been applied and studied for over 30 years. If we could just make sure we're muted. Thank you. Bernard, if you could mute your mic, please. Thank you. And the key to this slide, I think, is this top part where it says, without follow-up, practice, or feedback, most practitioners have zero proficiency in MI other than after just attending a workshop. So I say that for you to take advantage of some of the resources that I'll be providing here after today's practice call, community practice call. Also take advantage of any webinars that are coming up through FCS and practice with supervisors, colleagues, spend some time using some of the skills that we're going to be talking about today with individuals that you're working with. So that is just to really reinforce the need for practicing and using these skills after today. Some people use various words and phrases to convey their reasons for making a change. And we're going to get right into looking at change talk and sustain talk. Sometimes they also share reasons against making a change or keeping things the same or the status quo. In motivational interviewing, these are referred to as change talk and sustain talk. Making a change can be difficult, and often we have reasons for changing and reasons for maintaining the status quo, not changing. And this can sometimes feel like this picture depicts an internal tug of war, right? And how the practitioner, how we respond as job coaches, career coaches, employment specialists, how we respond to both the change talk and sustain talk can impact the likelihood of that change occurring. So we're going to get into change talk. Change talk is any talk from the person, from the individual participating in services, the job seeker, that favors movement towards or supports change of their target behavior. When we think about a target behavior, that really is aligned with the goals. So the target behavior might be completing a resume, and the goal might be obtaining a job. So, as we're kind of going through this, think about the target behaviors and goals that individuals that you're working with have. So maybe we can spend just a minute using the chat or unmuting your mic to talk about what are some of the goals and target behaviors that the person that you're working with, people that you're working with might have. What are some of the overall goals? And then what are some of those target behaviors? We'll just wait another few seconds, see if anyone uses the chat to identify what some of the goals are that someone might have and those target behaviors. You know, MI was originally developed for substance use and smoking cessation specifically. So a lot of the target behaviors were reducing use, quitting. So when we think about it in terms of goals related to employment, goals might be going back to school, going back to work, and the target behaviors would kind of be those interventions or objectives to meet that. Carolina writes in the chat, creating structure, setting up plans. Rosalita is writing in the chat. A lot of folks I work with are obviously looking for work. And when they come into an appointment with a few job leads they found during the week, I always think that that's a good sign. It's a behavior that demonstrates that they are actively looking and working towards their goal. Yes, that is a target behavior, bringing in job listings or identifying employment in the community. Self-sufficiency, target behaviors could be learning the bus system or getting their bike or car in working order. Absolutely. So yeah, so as we're going through, think about what that what those goals are and what that looks like. Change talk can express the person's desires, ability, reasons, and need to change. We're going to get into that. Darn. Okay. So if you can think about change talk expressing the person's desire to change, ability to change, their reasons to change, and also their need to change. And it can also convey their optimism about making a change and the benefits of succeeding in that change. As employment specialists, providers, job coaches, job developers, we should be acknowledging, reinforcing, and summarizing change talk when we hear it. So for example, if a person who has been considering going back to school, but has also expressed ambivalence about it, shares that their new job has a requirement that they obtain their bachelor's degree, the employment specialist can highlight this person's change talk. And that could be something like, it sounds like you might be thinking about returning to school sooner than expected because of the expectations of your new job. You're reflecting and highlighting that change talk back to the person so they hear it. Let's see what we have here in the chat. So we have two. So Catherine mentions leaving their space and transportation can be tough. We use a lot of MI to share that when you can meet us, then you are getting into the habit of making it to work on time. Yes, so kind of, using that motivational interviewing in that way is seems particularly helpful. The key to our success, Efren says, is their adherence to their care plans or service plans. The motivation has to be consistent, and our team is ready to provide assistance and resources to support our clients. Absolutely. So knowing those supports are there. So we introduced the darn, right? Desire, ability, reasons, and need. So again, we're just focusing on change and sustain talk today. There are two types of change talk. The first is preparatory change talk, or a discussion of the person's desire, ability, reason, and need to change. It's also known in MI as darn. And this is important to understand because understand these different types of change talk so that when you recognize it, you can reinforce it when you hear them. So again, when you are recognizing a person's desire, ability, reason, or need, and the talk that goes along with that, you can then reinforce it, reflect it back to the person, use the other MI skills that many of you identified already using. But let's look at D. D is the desire, the person's desire to change. Desire for change can be identified by use of words like want, like to, or wish. So if you hear someone using those types of words, for someone who wants to get in physical shape, it might be, I want to reduce my bad cholesterol. I would like to get a better job. I wish I were more comfortable around people. So you're hearing that from the person their desire. So you want to reinforce those statements, right? It sounds like getting along better with people would enhance your self-esteem, or whatever that might look like in that context. But you want to reflect it back, use those other MI skills that you're all currently using. Ability might be, their belief in their ability to make the change. So when someone conveys their ability to change, they might use words like can or could or be able to or possible. For example, you might hear things like, I can get a job. I could quit drinking. It's possible for me to find friends at work. Ability language suggests that the person believes that the change is possible for them to achieve, and would be positive as well. R is the person's reasons for change. It may sound like a rationale or a justification or a motive for making the change. So reasons often come in the form of if-then statements. If I went back to school, then I could probably get a higher paying job. If I stop smoking, I will be able to save money that I'm spending on cigarettes. Or if I exercise more, I'll be able to have better control over my diabetes. So it's more of a health and physical need. And the person's need to change, and highlights the overall importance of, or the urgency to change. So need statements don't say specifically why change is important, but instead convey a general level of need. You may hear words like, I need to, or I have to, or I can't keep doing this. So it might be, I've got to get a new job. I can't keep going on in this relationship. I must stop using drugs. I must stop using alcohol. So you want to be listening for this type of change talk and reinforcing it as you hear it. And maybe the simplest and most direct way of evoking change talk is to ask for it. So asking open-ended questions for which change talk is the answer. So in essence, you're inviting the pro-change members of this like internal dialogue. So you're asking open-ended questions that the person can kind of hear the change talk themselves. So just to kind of check in, Holly mentions in one of the chat messages, how do we avoid the spiral of them getting too overwhelmed with all these things they need to do? Well, we're not necessarily telling the person what they need to do. We're listening for them. So we're listening for them to identify desire, ability, reason, and need, and then we want to reinforce it. So for someone who is saying something like, I need to get a job, or if I don't go back to school, then I won't be able to be promoted. And sometimes it can sound overwhelming, but that's when we use our reflections. It sounds like returning to school could be stressful. How have you managed that stress in the past? So, using some of those other techniques and strategies can help. Are there other, here's some of what we might hear. I want to socialize more with my coworkers, a desire. I can get a promotion at work. If someone says that, you're meeting with someone, they can say, my coworker just got promoted. I can get a promotion at work. Reflecting back to them, what would that look like to you? What might be the benefits of getting a promotion? Or it sounds like you have the skills to advance in this job. What are some next steps? So when you're hearing it, you're reinforcing it using some of the open-ended questions, affirmations, reflections, and then also summaries. So the reason, if I went back to school, then I could probably get a higher paying job. You want to reflect that back to the person. It sounds like school would be an option to getting a higher paying job. It seems like now might be the time for you to consider school, since it's going to create opportunities to get something higher paying, whatever that reflection is. I've got to get a new job. Your job currently isn't satisfying you. It sounds like your position is not rewarding. It sounds like you're, whatever the context of why the person needs to get a new job, you want to reflect that back. Are there any other preparatory change talk in these areas that you have heard? So maybe you can give an example of desire. What have you heard people that you're working with talk about? And it's can be related to getting the job. It could be related to keeping the job. It could be related to satisfaction on the job. That might be that socializing with coworkers or interacting more. What are some desire preparatory change talk that you might have heard? Or you can even type it in the chat if there might be even an A, R, or N, just put it next to it. Okay, Heather writes, I want to be independent, is one that you've heard a lot. Yes, yeah. So how might you reflect that back and let the person know that you're hearing that change talk? How would you amplify that, if you will, or at least acknowledge that change talk, Heather? What might you say? I want to be independent. I'll give Heather a couple of minutes to respond in the chat. Alma, I want to find a better paying job. Yes. So when someone says that, you as the provider, the employment specialist, want to acknowledge that and follow that up with those MI skills. Heather's saying, it sounds like you're wanting to be more self-sufficient. How do you feel you can achieve that? Yes, perfect, on the fly. Great response. You're reflecting, and then you're also following it up with an open-ended question. I want to not be homeless. Yes, acknowledgement. Great. So listen for that preparatory talk. Now we're going to get into a little bit of an activity. Well, there's one more chat. Let me make sure. Rosalita, I want to keep my housing. I don't want to lose my housing is one we hear a lot. Yes. So think about how you would reflect that back, and you're evoking more change talk when you hear that. You want to evoke kind of their desires and ability and their reason and need. So if you can take a picture, just use the QR code here. This is a darn ruler that we developed based on Miller and Rolnick's work within our Mental Health Technology Transfer Center, and it's part of that curriculum that I was telling you about in the beginning. Just give me a little bit of a sense of whether or not you're able to download it. So just maybe give a thumbs up or just a yes in the chat or a no, just so I can make sure it's all working according to plan. Okay, so we're going to look at this together. If you're using your phone, you might just have to expand it a little bit. Again, this is all part of the package that is in the resource list here and on these slides, but think about a change that you're considering making. So you downloaded the QR code. If I could have a volunteer, that would be great. I know sometimes that puts people on the spot, and I certainly wouldn't want to do that. So if it's a change that you're comfortable disclosing and discussing, that would be wonderful. If we can have a volunteer to talk about their change and kind of walk through this a bit. Okay, so if you would like to, just unmute your mic or give me a heads up in the chat. because it can also be helpful to gauge where people are at in their change process as it relates to their desire, ability, reason, and need. And this darn ruler activity can help you understand where a person's at, where they are regarding their motivation, and identify activities to help deepen their commitment to change. So if there is a volunteer, that would be great. If
I can
not,
volunteer.
thank you, Amma. So anything that you're thinking about changing that you're comfortable talking about with others, and it should be a change that you're still kind of debating, that not one that you've already committed to making. So something you're still sort of ambivalent about. And then as others are kind of following along with their own change, so take out the ruler. So look at the ruler here. So Amma, on a scale from, and again, I'm just going to quickly go through this. You all will be using all of your great OARS techniques and really kind of, using it in a much more refined way, but we're just kind of using it here as a quick example. So on a scale from 1 to 10, 1 being the lowest and 10 the highest, Amma, what is your desire to make the change?
I'm gonna say an 8.
Okay. And what about your ability to make the change?
Oh, I think it would be at 7.
Okay, so 8, 7, okay. How strong are your reasons for the change?
At 10.
10, okay.
Yes.
And how strong is your need for this change?
I'm gonna say a 10 as well.
Okay, so then we want to look at, Alma's scores are fairly high. So, she seems to have pretty high desire, pretty high need, certainly ability and need, or I'm sorry, reason and need are certainly high. Ability is kind of the lowest. So if you think about the lowest that you scored, that might be the area that could be holding you back. So you want to explore this area further by asking, I'll ask Amma, you identified that you were a 7 on ability. Why did you not choose a number lower than 7?
Because I think I do have the ability to do it. And I think it is pretty possible for me to do it. I just need to be able to invest the time in it and really fully focus in that. And because of all the things that I have going on, sometimes those take priority.
Mhm.
And I may be able to work on it as I can, but it's not as in my priority scale as the rest of the other things that I have.
So
So
it
it kind
sounds
of gets put a
like,
little bit in the back burner.
you have lots of things currently going on, and this change isn't number 1 on your list of priorities or things to change.
Yes.
Why did you choose a number, or why did you not choose a higher number for ability? Why didn't you choose an 8 or 9 or a 10?
Because I believe that I still have to learn more into it. I think my ability to be able to get that change is not 100% there, or else I think I would have moved forward with it and got it going. And
Mhm.
it wouldn't be as far in the back burner as the other things are. So I got a little bit of knowledge, a little bit of things that I need to learn into. I need to put in a little bit more of time into it. And not having that is kind of what sets me a little bit back.
You feel limited in your time to work on this change.
Yes.
What would it take to get you to maybe a 9 in your ability?
Probably time management.
Time management, okay.
Yes.
So it sounds like the prioritizing, but also managing your time to fit in this change is something that would help you
Mhm.
move closer to getting and achieving this change.
Yes.
Great.
So then there goes another change that I may need, right? Working on my time management.
So thank you for volunteering. We won't have a time to spend too much on it, but do you see what we were doing? We were talking about the lowest score, and that may be why the person hasn't made the change yet, right? So you're kind of probing into these scores to help identify skills or knowledge gaps that can be further explored. So for example, if the low score like AMA's was related to ability, the person may not feel they can make the change. You could address this by asking some of the questions that I did, but also expanding on asking the person to talk about how they have made successful changes in the past. How have some of these same skills, how could they be applied to this change? Amma talked about time management. Maybe I would explore a little bit more with her about times in the past, because remember, this is ability. So the person's belief that they can do something. I might explore with Amma times in the past that she was able to manage her time and achieve certain goals and prioritize really important things that she wanted to achieve. If the low score is related to reason, the person may not see a clear connection between making the change and a desired outcome. Explore those connections between the possible change and outcomes the person is motivated towards. So there's example earlier about the person wanting to return to school, or the person wanting to get a higher paying job, but they might need to return to school, exploring that a little bit more, making those connections. It seems like the options for you to receive higher pay, a higher paying job, a promotion are limited until you go back to school and gain that additional credential or whatever that might be. So you want to explore those connections. And again, we're kind of going through this rather quickly. But I think it's sufficient enough for you to take with you and learn. But I also really encourage you to check out the curriculum that we developed. It's free. It's right on our website, and I'll add that information. So the components of DARN, desire, ability, reason, and need, represent preparatory change talk. There's also mobilizing change talk, which is the CAT, right? So that builds on preparatory change talk and includes commitment language, activation language, and taking steps. In MI, these go by the acronym of CAT. Just like with preparatory change talk, it's important to be able to recognize mobilizing change talk so you can reinforce it. So I'm going to go through commitment language, might be words or phrases that indicate the person has made the decision to make the change. Commitment language can sound like I will, I'm going to, I intend to type statements. I will submit applications for a new job. I intend to drink tea instead of coffee in the morning to reduce the amount of caffeine I take. Activation language conveys the person's willingness and readiness to change. It can sound like things like, I'm ready, I'm planning to, I'm prepared and or willing to make a change. You might hear statements like, I'm ready to exercise, I'm prepared to stop drinking, or I'm prepared to submit my applications to 4 employers this week. Taking steps refers to those particular actions that the person has taken in the recent past that are linked to the target change or target behavior. These might sound like specific steps the person has taken. For example, if someone wanted to, work on their health, it might be, I went to the grocery store and bought health foods and then threw out all of the junk food in my cabinets. For someone who's working on getting, their physical health in shape. Or it could sound like I collected applications from stores in town. So where the darn statements tend to be shared more when the person is still deciding to make a change, these cat statements suggest that the person is ready to take action. So now that we've looked at the darn preparatory change talk and the cat mobilizing change talk, let's do a brief activity to see if you can identify what type of change talk is being shared in these 8 examples. So look closely at the verbs. Again, this is just kind of a helpful way for us to remember what we're hearing. So they're all not necessarily related to employment. So I added some that were, some were not. So I'm going to read each one, and in the chat, just, could just type down or even just, unmute your mic. So I think I could quit. What would that be? If you look at desire, ability, reason, need, and then also mobilizing, commitment language, activation language, taking steps. So ability, yes, ability, yep. I think I've got to do something about my drinking. Need, yes, need. I wish I were more comfortable around people. Someone says, I wish I were more comfortable around my coworkers. I wish I was more comfortable speaking with my supervisor. Desire. So then you can follow that up, right, with some probing questions. I want to get my kids back, and I can't do that unless I quit drinking, or I want to get my kids back, or I can't do that unless I get a job. Reason, yes, if then. I'd like to have better control of my drinking. So I'd like to have better control of my drinking. Desire, yes, I'm going to stop using. Yeah, could be ability. I'm ready to exercise. So someone who wants to exercise and get in physical health. So you get the idea. I redid my resume yesterday. So think about, not just preparatory, but mobilizing. I redid my resume. That would be taking steps. So something recent that the person has done to move toward the change. Absolutely, excellent. So great job. So just again, reminder to listen for it, and then to be reinforcing these statements when you hear them. So sustained talk is the opposite of change talk. And it's language that suggests not changing or staying the same. Sometimes people have the desire to maintain the status quo. The person may not be interested in making the change, or they may enjoy or want to continue their current behavior. So if you think about work, maybe the person doesn't think there would be much positive to change. Maybe they've, they're concerned about losing benefits, and they don't see that there's any real positive to that. So they may be, saying statements like, well, what's the point? They're just going to cut my check. So you don't, what's important when you hear sustained talk, you don't want to reinforce that. You want to, encourage the person to think of it from the other end. The person may not believe in their ability to change. They may not feel like they're ready or able to make a change. You want to also look at the person may not feel that there's much reason to change or need to change. So when you think about change talk and sustained talk, they are often kind of intertwined with one another, and it can represent ambivalence that the person is experiencing. And generally speaking, you want to avoid reinforcing or really following up on sustained talk. You don't want to get into that, following up. My friend went back to work, or my roommate went back to work, and his check was cut. You want to resist. Tell me more, how much of it was cut, or, what happened with his check, or, oh my gosh, that's terrible. You want to really try to avoid reinforcing and following up on sustained talk. When we are talking about sustained talk and discord are really what we used to kind of refer to in motivational interviewing as resistance. We've moved away from the term resistance in favor of discord and sustained talk. Discord is a normal reaction when someone's feeling pressured or challenged to do something, usually manifests itself in statements like, yes, but. And as employment specialists, it's useful to view discord as feedback from the person to help us better understand and identify the types of strategies that might best help the person move towards their change goals. The practitioner might need to move back to evoking and reflections and active listening skills. The discord can be viewed as the practitioner and the person making the change, the job seeker, the person that you're working with, maybe not being in agreement about the next steps. So what happens is, the employment specialist might be in a planning stage, right? And the person may not be there yet. So kind of stepping back and really listening for those areas of change talk, reinforcing that area can kind of help you and the person be more in line with what some of those next steps might be. A lot of times we jump right into planning, right? We want to get things, on the plan and get things started. We might be too far ahead, and the person may need to have some more discussions, or really listening, or maybe even using the darn ruler with the person to really hear where they are with their desire and ability and reason and need before moving into planning. So when we do talk about planning and the change plans, we want to help the person think about what that change plan might look like. People might have, we know that people with specific change plans are more likely to follow through with the change. Providers want to listen for change talk and help to strengthen that change talk to facilitate movement towards this planning stage. So planning is not just done once. It's really this ongoing process that you'll need to revisit over time. So to help mobilize change talk in the direction of planning. So planning in this sense would be what are some of the goals that you all identified earlier? Going back to work, going back to school, applying for that job that has been advertised and the person really wants. So to help mobilize change talk in the direction of planning, you can try some of these specific techniques. Ask questions about the change. How will this make your life better? Or what will your life look like after making this change? So maybe when I was talking with Alma, I could have asked some of those questions if we were, meeting and kind of getting into the meat of it. And I was listening for her preparatory change talk. I might have asked some questions like that. These types of questions help the person visualize the impact of the change. Key questions are questions that are asked in a non-committal way, what the person could do to make the change. For example, what might be the next step, or what do you think you'll do? Should we talk about some possibilities? These key questions help people to think about next steps. Pregnant pause is also a strategy to use. It's silence to allow the person time to think and reflect don't be too quick. I don't know how you are, but I know sometimes I don't like to hear that silence. I'm very quick to fill that. Don't be so quick to fill that silence. Sitting there with a pregnant pause could encourage the person to provide information themselves and not expect you to fill in those gaps. So if you can be comfortable with that silence for a bit, that could encourage the person to further discuss with you. Troubleshooting is an opportunity to explore possible obstacles that the person might encounter and plan for strategies and ways to address those obstacles. So you might want to ask open-ended questions about what the person thinks might get in the way of their success. So with AMA, I might have asked some more questions about, what might get in the way of prioritizing this change, what might get in the way of your time management around this change. So discussing potential challenges and how the person can respond also encourages mobilizing change talk, which can lead to planning. You have to be careful, as I mentioned, with moving too quickly into planning, though. If you try to develop a change plan before the person is ready, you'll need to move back into that other kind of evoking and listening for change talk. So maybe after today, if you have some time, and as I mentioned earlier, this is all good for one session, but practicing it and reinforcing it and kind of keeping your skills honed in MI, and particularly the darn ruler activity. So after today, identify someone you're working with, maybe someone who's ambivalent about employment or considering making an employment or an education related change, or the person might just be stuck. Practice using the darn ruler. Ask them about the change they're considering, define darn and what each area means, and then together, like we did with AMA, go through the darn process. And when you're finished, you can ask for their reflections, and then also, ask them what do you think? How was this? Was it helpful? And it doesn't have to be an individual you're working with. Maybe it's a friend or family member, if you want to practice it, colleague, if you're comfortable, your supervisor, whoever that might be. And then reflect on, what did you learn through the experience? So you'll get this presentation after today. So we have a minute or so for Q&A, but we've been kind of talking throughout. Just to summarize, we're building on change talk to enhance that internal motivation, noticing sustained talk, not reinforcing it, helping the individual move towards making a change plan when they're ready. Any questions that you have? Or what are some questions that you might have? I'm going to put my email in the chat, and if you have any additional questions or feedback, please feel free to get in touch with me. This is all going to be mailed out along with the recording. So if there's nothing else, here is the reference of what I was referring to, the motivational interviewing series, our Mental Health Technology Transfer Center, 6-hour curriculum, 6 modules. All of the notes in the notes pages can provide some good information. So please check it out, again, free of charge. And when you get this, I've also noted the Integrated Employment Institute website with some additional resources, as well as the Northeast and Caribbean MHTTC website with some resources. And as we are leaving, just want to thank you, appreciating your time and attention today. And if you have specific information about becoming an FCS provider, you can reach out to the AmeriGroup here listed, and we'll see everyone in August next month. So enjoy the rest of your summer and continued summer, and reach out if you have questions. So thank you, everyone.
Thank you so much.